I washed my hands before coming into the room. Hi, I'm going to be your student nurse today. My name's Emma. I'm just going to ask a few questions before we get started, if that's okay?
Yep.
Okay, so your name is?
Karina Kuchta.
Okay, perfect. And do you know where we are?
Yeah, in the hospital.
Okay, and do you know what date it is today?
It is November 7th,
Yes.
2016.
Perfect. Okay, so the patient seems to be the stated age. She is a 15 on the Glasgow Coma Scale because she seems alert and present in the moment. Her skin color is even. The color is good. There's no visible lesions anywhere. She is in a comfortable position for the situation. She didn't come in with any assisted devices. Her body odor and hygiene seems perfect. She is in a good mood and her facial expressions are good for the situation. And hearing seem good as well. Hair seems even bilaterally. There's no sign of any clubbing. Nails look good, strong. Capillary refill, less than 2 seconds. So that's good. You can put your hands down. Now I'm just going to check your scalp and your hair. I'm just going to put my gloves on quickly for that. Okay, if you don't mind tilting your head down a little bit. Alright, everything seems even. So normal cephalic. Your hair seems very healthy and evenly distributed. Alright, perfect. No sign of any critters. Okay, so now I'm just going to check the symmetry of your face. It looks good. Everything's even. So I'll get you to just raise your eyebrows and smile and frown. And then puff out your cheeks. Perfect. I'm just going to feel your sinuses quickly. Let me know if there's any pain. Does it hurt?
No, we're good.
Okay, perfect. So now I'm going to test your eyes. So we're going to start with the confrontation test, which is going to test your visual fields. So I'm just going to give you this to cover one of your eyes. And I'm going to cover the same eye. And then keep your gaze straight and just let me know when you can see my fingers, okay?
Okay. Now. Now. Now.
Okay.
Now. Now. Now.
Okay, perfect. And I'll get you to switch eyes and do the same thing.
Now. 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 Now.
Okay, perfect. So now I'm going to test your extraocular muscles. So I'm just going to flash this light in your eyes. Okay, so I can see that the light is shining off of both pupils in the same spot, which is good. So next we're going to do the cover uncover test. So I'm just going to cover one of your eyes, okay? Okay, and the other eye. Perfect. So I can see that you're not doing any unnecessary accommodation with that, which is good. So next I'm going to check, we're going to do the diagnostic positions test. So I'm just going to get you to follow this pen light, okay?
Okay.
Good. So your eyes are moving equally, which is perfect. There's no stigma. So now I'm just going to inspect your outer eyes. So eyelashes are good. They're flipping up. Your eyebrows have equal hair distribution, which is so now I'm gonna inspect your conjunctiva, which is good. And your sclera is white, which is perfect. Your iris is the color that it should be, which is green, and your pupils are black. Your pupils are also round and equal and reflect light, so I'm just going to check accommodation now. So if you can just look at the pen and follow it, I'm going to bring it close to your nose, okay? Perfect. So they accommodate as well. And it's about 10 degrees away from vertical, which is good. So I'm just going to touch your ears and just let me know if there's any tenderness or anything. Anything? No, they feel good. And you have a good recoil of your pinna. So I'm just going to give you 3 words to repeat back to me as you press in your tragus, okay?
Baseball. Tuesday. Carrot.
Okay, perfect. And do the exact same thing with the other ear.
Thursday. Soccer. Apple.
Perfect. And I can also see that the color of your ears is the same as your face, which is perfect. So now we're going to move on to the nose. So it looks good, no lesions or anything, no discharge coming out. So I'm just going to plug one of your nostrils and get you to breathe in. Okay, so perfect. And the other one. Alright, so next we're moving on to your neck. So your symmetry looks good. There's no noticeable bulges or any pounding pulsations, which is perfect. I'm just gonna check your carotid pulse. Make sure it's there.
And the rest of my body.
And on the other side. They're good. They're about a +2, which is normal. So now I'm going to check your lymph nodes. So I'll start with your post-auricular. And let me know if you have any pain or anything. Pre-auricular. Your jugulo-digastric. Your deep cervical chain, your supraclavicular, and your submandibular, both sides, and submental, and then your occipital. And your superficial cervical. And last is your posterior cervical. Perfect. So you had no pain?
No pain.
Okay. Next, I'm just going to take a look at your trachea and palpate. So it's midline, which is good. Now I'm going to check your range of motion of your neck. So if you can tilt your head to the left and the right, and bring your chin to your chest and back, and then look to your left and your right. Perfect. Now I'm going to check your muscle strength. So I'm just going to apply a little bit of pressure, but we're going to do the same thing, okay? So just push against my hand. And the other side. And ear to shoulder. Ear to shoulder. And chin to chest. And then back of your head to your back. And then can you just shrug your shoulders? And then I'm going to apply pressure. Good. So that's perfect. And then last thing, I'm just going to get you to drink a little bit of this water. And I'm going to palpate your thyroid gland, okay?
Okay.
Okay, good. So I can visibly see it going up and down, which is Alrighty, so now I'm gonna move on to the abdomen. So I'm just gonna go check your contour. So it looks good and even. There's no visible bulges or anything. You're symmetrical. There's no abnormal distension. Homogeneous in color, which is perfect. So now I'm just going to take a listen to your bowel sounds. So I'm going to start at your right lower quadrant and move around.
So next I'm going to move to colonic.
So I can hear,
And again, I can hear
high-pitched gurgling noise, which is what we want to hear. Okay, so I'm going to listen for your aortic, iliac, femoral, and renal arteries. Okay, so I'm going to start with your aortic and your renal.
Okay.
And your iliac. And femoral. Perfect. So I'm able to hear pulsation in each of those arteries. Okay, and now I'm going to percuss your four quadrants. So I'm going to start with your right lower quadrant. So I'll hear a dullness here because of your liver. Moving over here will be the same because your spleen's here, so it's also a dull sound.
And the tension feels all the way. Okay. Just let me know if you feel any tenderness in any of your joints.
And tympany and the rest, which is good. And then I'm just going to quickly palpate and just let me know if there's any pain or tenderness anywhere.
Just going to get you to flex your hands downward. Okay, and then extend them back to normal. And then
Do you feel any pain?
no. Okay, so
Feels okay?
yep. Fingers apart.
Alright, perfect. So we are going to move on to the posterior chest. So I can see just by looking that your anterior posterior to transverse is about a 1-to-2 ratio, which is good. Your thorax is symmetrical. There's no lesions or unevenness in your skin. Your shoulders are equal space apart and your muscles look good. So now I'm going to test your symmetrical expansion. So if I can just get you to take a deep breath in and out. Okay, it's good. It's about 3 centimeters, which is normal. So now I'm going to get you to say 99, and I'm just going to move throughout your back. Yeah, so you can start.
99. 99. 99.
And I'm just feeling
99.
for vibrations.
99. 99. 99. 99.
And that's perfect. So it's very clear at the apex and gets less as I go down. Now I am going to palpate your spinous process. Make sure there's no lesions or bumps of any kind. And there's not, so that's good. And next I'm going to percuss your lungs. So that's good. I can hear resonance I'm just going to quickly percuss your costovertebral angle, so just let me know if there's any tenderness or pain, okay?
Okay.
Does it hurt?
No, we're good. Okay,
I'm going to take a listen to your lung sound, so I'm just going to go start at the top and work my way down. So I'm just going to get you to breathe normally, okay? Perfect. So they're just normal breaths, clear and effortless, which is good. It's even throughout, smooth skin surface, which is good. Your respirations seem rhythmic and effortless. So I'm just going to do the same thing that we did on your posterior. So I'm going to press on your chest and just want you to say 99, okay?
Okay. 99, 99, 99, 99, 99, 99.
Okay, perfect. So I felt small vibrations, which is good. So now I'm just going to listen to your breath sounds. So I'm just going to start with your tracheal. So just take a deep breath in. Okay, perfect. So that's nice and loud. And then your bronchiovesicular, which is good. Sounds like a blowing sound, which is what it's supposed to. And then your vesicular. Awesome. So that's just a gentle sighing sound. So they all sound good. Precordium to make sure there's no abnormal pulsations and there's not. It looks good. So now I'm gonna listen for your heart sounds. So we're gonna start your aortic, which is at your second intercostal space. And I'm able to hear your S2 louder than S1 in this position. And then we'll go over to your pulmonic, which is also at your second intercostal space on the left. That's good. And then moving down to Erb's point, which is very loud. And then moving down to tricuspid. And then mitral, which your S1 is louder than your S2. And I can tell that all of the sounds are rhythmic and good. Okay, so now I'm just going to assess your upper extremities. So just by looking, I can see that they're all symmetrical. So the same bilaterally, which is perfect. So now I'm just going to do some exercises with you to test your range of motion. So if you could just follow with me. So I'll get you to extend your arms out and bring them up. And then back down, and then bring your arms out again, flex your wrists up and then down, and then I'll get you to hyperextend your arms, perfect, and then I'll get you to raise your shoulders and bring them back down. See if you can bring your arm close to you and away, and the other arm in and away, Perfect. So now I'm just going to apply a little pressure to make sure that your muscle strength is good. So if you could just push up against my hand. Okay. And push down against my hand. Perfect. And the other side, push up and push down. Okay. And then push against my hands. Okay. So your muscle strength is about a 5, which is perfect. So now I'm just going to palpate your pulses. So your ulnar pulse, your radial, which is good. Brachial, sorry. And then I'm going to palpate your epitrochlear nodes. So just let me know if there's any tenderness or pain.
Nope.
Nope. Okay. Now we're going to palpate your inguinal area. So I'm just going to check for your femoral pulse, which is good and strong. And then I'm going to just quickly check your inguinal nodes and just let me know if there's any pain or tenderness.
Nope, we're good.
Nope. Okay, and now I'm going to move on to your lower extremities. So just by looking, they're symmetrical. There's no noticeable atrophy of your muscles. The temperature is even bilaterally, which is good. So there's no visible varicose veins by looking. No lesions or any abnormalities. Okay, so now I'm going to palpate your pulses. So I'm just going to start with your popliteal pulse, which is good and strong. And then I'm going to move on to your posterior tibial pulse, which is also very good and strong. And then the last one, I'll check your dorsalis medius pulse, which is also good and strong. Okay, so I'm now going to inspect your toes and separate them, and they look good. There's no edema or anything. So now I'm going to do check your range of motion. So are you able to lift your leg and flex your hip like that? Okay, and back down. And then I'll get you to flex your knee and then back down. And then I'll get you to dorsiflex your foot, so point it up towards your knee, and then plantar flex down towards the ground. And then I'll get you to abduct your leg out and adduct it in. And if you want to do the same on both sides, so we're just going to flex your hip and extend it back down. Flex your knee and extend it back down. Point your toes to your knee and then back down to the floor. Swing your hip outwards and back in towards your midline. Okay, perfect. So that all looks normal and even bilaterally. So now I'm going to test your muscle strength. So we're going to do similar exercises. I'm just going to get you to I'm going to apply some pressure, and you just push against my hand, okay?
Okay.
So if you can lift your leg up and push it back down, and then push against my hand, and push against my hand. Okay, perfect. So your muscle strength seems to be about a 5, which is normal. Okay, now we're going to test your neurological status. So what we're going to do first is I am going to touch your skin with this sharp end, so if you want to feel what that feels like right off the bat, and this dull end. Okay, and then you just close your eyes and let me know if it's dull or sharp that you feel. Okay?
I wouldn't even say
Sharp.
it again.
Dull. Sharp. Dull. Sharp. Dull. Okay, perfect. So now I'm going to check your ability to sense vibration. So just let me know if you can. Just let me know if you can feel this. Okay.
Okay.
Yeah. 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 Yep. And then I'll check your tip. Yep. Perfect. So, now I am going to get you to close your eyes again.
Okay.
And I'm going to get you to hold out your hand. I'm going to put 2 different objects in your hand, and I want you to tell me what you feel. Okay? So this is the first object. So just feel around.
Paperclip.
Yep. And this is the second object.
Marker.
Yes, perfect. So now we're going to do an exercise where you touch your nose and then touch my finger, okay? And do
Okay.
it as fast as you can, okay? Okay, that was perfect. You did it in a very timely fashion. To get you to slide your opposite foot, so this foot, bring it to this shin and slide it all the way down. Okay?
Yep.
And do it on the other leg. Okay, perfect. So you were able to do that with good coordination. Okay, so now I'm going to test your reflexes. So I'm just going to take this and test each reflex. So first off, I'm going to check your your tricep reflex. So if you can just let that go, I'm just going to hit it quickly. Okay, awesome. And now, okay, now I'm going to check your bicep reflex. Okay, perfect. So that was good. And now I'm going to check your brachioradialis reflex. Just your fingers. And one more time. Perfect. Check your patella reflex. Okay, perfect. And one more, I'm going to get you to lie down. And I'm going to check your Achilles reflex. Okay, so next I'm just going to quickly test your Babinski reflex. Okay, so that's just on your foot here. Okay, so I saw just a slight bend in the toes, which is what we want to see. Also, I have a test to do. I'm going to place this at different parts on your skin, and you can just let me know if you feel it, okay?
Okay.
Okay, close your eyes.
You're doing this first.
Okay. So you can feel that all over your body. So next we are going to, you can have a seat, so you can sit up.
Okay.
And I'm going to take your thumb, and I'm either going to put it side to side or forwards or backwards, and you just close your eyes and let me know what you feel, okay?
Okay.
Side to side. Side to side. Forward to backwards. Okay, so now we're going to test your musculoskeletal abilities. So I'm just going to get you to walk to the end of that bed, just how you normally would. And then turn around and walk heel to toe. Okay. And now I'm just going to get you to stand with your eyes closed. So we're going to do the Romberg test. I'm just going to check for any swaying motions. So it looks pretty good. No abnormal swaying. Now I'm just going to get you to walk on your toes for a few steps. And walk on your heels on the way back. Okay, perfect. Now we're going to check your range of motion. So if you can bend at the waist frontwards and touch your toes. Perfect. And if you can do a lateral bend to your side and to the other side. And then if you can twist around your waist. And lastly, if you can hyperextend your back. Okay, perfect. So you have all your... Okay, so that's the end of your physical assessment for today. I didn't find anything abnormal, so you're all good to go.